again, friends. So let's talk about how we count our cases in Manitoba. So you've probably heard us talk about the total number of cases, maybe even the recovered cases, those in hospital, deaths, but how does it all add up? So we have a number of different categories. One would be called active cases. So active cases is just everyone who right now is experiencing the infection. So they're ill and currently a risk to other people as well for transmission. Recovered means somebody who did have the infection, they were ill, but they've now had no symptoms for at least 24 hours, and so we think that their risk to anybody else is very, very low, and they probably wouldn't be able to get the infection again, at least not in the near future. Death, I think, is pretty self-explanatory. Somebody who had the infection and then passed away, we would usually be counting it as due to the virus, though as numbers get higher, there might be other causes of death even in people who are infected. And when you add all of those together, so the people who used to have the infection but they're now feeling better, the people who still have the infection, and the people who have died, you get the total number of cases. So the total number always increases because the more cases we diagnose, the more it goes into there, no matter what happens to those people. So the total case count is useful in some ways, but probably the active numbers are more useful to get a picture of what's actually happening in Manitoba right now. To count as a case for now in Manitoba, you have to be lab confirmed. That means that you have to have had a nasopharyngeal swab, so that's the swab that goes in through the nose to the back of the throat, to the pharynx, and it has to be tested at the lab and be shown to have the virus in it. In the future, as numbers go up, we'll probably start to count cases who have symptoms consistent with COVID and have a reason that we believe that they're infected. For example, if you live with somebody who you know is infected, who's a lab-confirmed case, and you start to have symptoms, we may move to a point where we assume that that person also has COVID and count them as a case. But for today, because our case numbers are still fairly low in Manitoba, we're really only counting lab-confirmed cases because we're able to actually test all of the people that we're very worried about.